Hello everyone, my name is Juan Carlos and I am a specialist in medical oncology and radiation oncology in small animals. I currently work at as a senior lecturer in the University of Edinburgh. Today, as Tommaso said, we're going to talk a little bit about radiation therapy in dogs and cats, as this has become an essential key treatment in cancer for pets. And it is quite helpful for general practitioners as well to know a little bit about this type of modality in order to help clients make decisions when you find a patient that may be benefited by this type of treatment. So we're going to start just with a very brief introduction of the different type of treatments that can be offered in oncology, which can be really classified as local treatments and systemic treatments. And although many people think that the most important or as important are the systemic treatments like chemotherapy or targeted therapy or hormonal treatment or immunotherapy, even though hormonal treatment is not really that used in pets because they can just be neutered. Actually, it plays a much lower role, a much smaller role compared to local treatments, such as surgery and radiation therapy. And in fact, most patients that are cured from cancer will be treated with surgery, and radiation therapy in humans is associated to around 50% of the cure. So both of those treatments are quite relevant from a point of view of tumor control. And this is because obviously you're giving a systemic treatment, you're likely to be limited in the amount of dose that you can administer, whereas if you're doing a local treatment, the dose that you can give is much higher. And then when we talk about radiation therapy, that just means using an ionizing radiation for treatment, but there are many types of radiation therapy that can be used, and each of them will have some type of advantage. So I'm very briefly going to mention these, and we will then focus in the most frequent one, which is basically external beam brachytherapy or teleradiotherapy. So just mentioning brachytherapy, you might actually know this term from a human or a friend or a family member that might have received this type of treatment because it's much more common in humans than it is in pets. And basically this means that the source of radiation is going to be either in the interstitium of the patient or inside a cavity like the cervix, for example. And basically it is used rarely, but it is used, and there are some institutions in Europe and in the States that can offer this type of modality. Basically, in the pictures that you can see in the screen, there is a machine from where the source comes out, and it goes through some wires which will then go into the interstitium of the patient, and then the little source will stay there for a specific amount of time depending on the desired dose, and then basically the source comes back. A specific type of brachytherapy that is not exactly inside the patient would be plagiotherapy, which is basically when the source gets in contact with the tumor directly. And this is very useful for cats, with also used in horses, but especially useful for cats with a small and mainly, more importantly, superficial lesions. This is because these type of source can give extremely high doses of radiation, but they only penetrate for a few millimeters. So it's a really good treatment for initial phase of a squamous cell carcinoma in the nose or a mast cell tumor in the nose. As long as it's not penetrating too bad, it typically will be associated to cures in this case, because obviously you can give a very high dose as the treatment is going to be only limited to the superficial layer. This again is available in some institutions in Europe and also in the States, but is relatively infrequent. And then something much more common would be systemic radiation therapy. So I'm sure many of you will be aware of the most common indication for this, which would be hyperthyroidism in cats. It's not typically associated with cancer. This is typically caused by thyroid hyperplasia, but it is still a very effective treatment, and it is associated to a cure, and by many it is considered a treatment of choice. Even when they don't have hyperthyroidism, thyroid masses, thyroid tumors can potentially be treated with this, because the thyroid gland or the tumor might still be able to uptake that I-131. And it's been proven to be effective both in cats and dogs with thyroid carcinomas as well, even if they have metastasis to the lungs, for example. It has some limitations, though. The main is that the patient will need to stay in the hospital in isolation for up to weeks until the urine release of I-131 is relatively safe for the owner to be in contact with the pet and for the dog or cat to go home. So this can complicate a little bit the installations and also the price. And it can also be difficult for some patients that are unstable because the owner needs to be aware, for example, if you have a cat with hyperthyroidism that also has heart disease or another comorbidity like chronic kidney disease, that if there is any complication, then the vet might not be able to act on the cat because depending on the time frame, it might be too high dose for anyone to really be in contact with the patient. This picture is just an image of a CT scan from a dog with a big thyroid mass. And again, with this one, the treatment of choice would be really surgery. But if the owners did want to try I-131, this could potentially give some additional time for the patient. And finally, the one we're going to focus on today, which is teleradiotherapy. It means external beam therapy. It means that there is going to be a distance between the source and the patient. So the patient is typically lying in the couch in this table here, and the source, the radiation is going to come from here. It's in these cases it's a linear accelerator, and the radiation is made by the human. It's basically a machine causing radiation, but there's also other similar machines that have a source inside, and then when the jaws of the head open, so these jaws here, then the radiation comes out. These here are wings that are a CT scan installed in the machine, and it's used typically to verify the correct position of the patient before the treatment is done. Not all the machines have it, but the most modern ones that have been bought in the last few years do typically have these. And then these would be the area from where the treatment beam comes. And you can see there's loads of little leaves that are going to be moving in and out and are going to be creating a shape so that basically we can create a beam that goes to the tumor but avoids the normal tissues. We're going to talk a little bit about that later, just so that I explain it in a better way. And very briefly, just wanted to discuss as well the difference between non-ionizing radiation and ionizing radiation. So non-ionizing radiation is any radiation that is of low energy enough not of high energy enough to be able to ionize the atoms of our tissues. So basically, for example, the typical scanners that we go through in the airport, or the mobile phone, like any type of the microwave at home for cooking, all of those would be non-ionizing radiations, and we don't have to worry about them. Whereas ionizing radiation refers to those radiations that are of enough high energy to remove an electron from an atom. And basically, this is going to be what's hazardous and what can be effective against cancer, because those electrons that are going to be moving around are going to be creating free radicals and damaging the DNA. And that's basically what's going to cause potential cancer or other diseases. And those are the ones that we have to be careful with. And there are many types of radiations that we can use for treatment. I'm not really going to go into detail, just so that you know that there are different types. And the radiation oncologists will choose that based on availability. For example, protons are something prohibitive in veterinary medicine. It's used in humans for very specific indications, but just so that you have an idea, a normal linear accelerator unit costs around £2 million, whereas a proton therapy unit costs around £200 million, £100 million if for a simple one. So obviously they're completely out of our hand unless it was for research purposes. So again, how does brachytherapy work? The way it works is basically this energy will act on the electrons of the atoms of tissue. Those electrons will then damage the DNA or create free radicals with the water of tissue, and that damage of the DNA is what's going to be causing the consequences. Typically, tumor cells do not die immediately, or most cells will not die immediately, including normal tissue cells as well. But they will die when they try to divide. Then that's when they notice they have this damaged DNA and they can't cope with it and they die. So we don't see the effect immediately. We typically will have to wait for days, weeks, or even months if the tumor is very slowly growing to see the full effect. And because of this, any dividing cell is going to be more sensitive, or it's going to respond faster. And this is why we will see the early effects of radiation, which I will explain later, in the tissues that are rapidly dividing, such as the skin or the mucous membranes. How do we dose for radiation therapy? So the same way we would talk about an antibiotic or anti-inflammatory in milligrams per kilogram. When we talk about radiation, we use gray, which means joules of energy absorbed per kilogram of tissue. And then the total dose of treatment is typically going to be divided in what we call fractions. So small doses that are going to be given every 24 hours typically, although sometimes, depending on the case, we might give it up to every 6 to 8 hours in the same day.